Well, good afternoon or good evening, everyone, and thank you very much for joining us for this particular session. I'm grateful to our wonderful colleagues at the Reh-Fit Center for the opportunity to join you this evening to share some ideas on how we can stay healthy, notwithstanding a cold, dark winter night amidst a pandemic. It might be nice just to think about something that we can do for ourselves to keep ourselves as well as possible. Some of the secrets that were common to all of these places, indeed, it was something in the water, it was something in the food, and more importantly, it was something in these different societies where overall people living in these places that regularly live to 100 years of age or older, most people lived their lives in a very active way. Whether it's their work or recreational time, most people moved for much of the day. And if you looked at their diets, most people had more plants or predominantly plants, not strictly vegan, all of them, but certainly a large proportion of their intake consisted of plants. They did not smoke, they limited alcohol, they had very strong social networks in these communities. They managed stress in a very positive way. And then also very importantly, a term that came from the Okinawan study was ikigai. Uh, and this is common across all kinds of places where this has been observed. Uh, that which makes one's life worth living. That is purpose, there's focus, there's a reason to get up in the morning and do very well. So if we reflect on this as an interesting anthropologic investigation and combine it with some of the medical things that we might know about from different kinds of studies that have reported on what contributes to the risk of heart disease or stroke or cognitive decline, we can come up with a list, a top 10 list, if you will. And that's what we'd like to present over the next 20 minutes or so. Just some ideas. And if we give you a top 10 list, then we're hopeful that maybe there's one thing that will resonate with you or your family, and maybe one thing that you might start kind of integrating into your daily lives, because there are these societies where people live long and live well. So we're going to go through these in turn, but for the quick list to get you primed, let's think about healthy bodies. Let's think about the cholesterol that might be floating around in us, daily fruits and vegetables, moderating alcohol, achieving a normal blood sugar and a normal blood pressure, not smoking, managing stress and other psychosocial factors, sleeping well. And then I'm going to round it up with physical activity, but I do recognize you're going to have lots about physical activity in the coming sessions in this wonderful series. So let's think about bodies and how bodies can be healthy. I think unfortunately in society, we focus a lot on body weight and the scale, and sometimes on body mass index. That is, are you tall enough for the weight that you carry? And frankly, there aren't really great studies that say body weight relates directly to bad things like heart attacks, although we have that picture in mind. I think it's a very unfair portrayal. And it does away with many good things that we can actually do. Much more important than body weight are the steps that we take on a daily basis, literally the steps of physical activity, for instance. That trumps way more than the needle on the scale. So what we do with the body that we have is much, much more important than the size of our bodies. And if you want to get a little bit technical about measuring something, then it might be that measuring the waist as a surrogate for what's going on with our internal organs is certainly much more important than just a simple measure of weight. And kind of one kind of concept, if we relate fitness and activity and movement versus body weight, this kind of analysis kind of brings this out. So a little bit complex. On the vertical axis here, we show the risk of dying, unfortunately, from heart disease or stroke. And across the bottom here, there are three different groups. One are people that are low to quote a normal weight. I don't think there's really a normal, but they've got lowish weights. In the middle are people with somewhat high weights. And then on the right side are people with fairly high weights. And the point here is that irrespective of which group you belong to, whether you're low, medium, or higher weight, the thing that really drives our risk of having a bad outcome from heart disease or stroke is, in fact, low, moderate, or high levels of fitness. And whether you're low body weight, medium body weight, or high body weight, you'll see that in every one of these groups, low fitness predicts bad things from heart disease. Conversely, high levels of fitness protect against heart disease. So being unfit is really the big thing. Fitness is much more important than obesity. So whatever your body size, move it. And that's the secret to longer health. Don't fuss so much about the scale. Item number 2, we said, was around cholesterol. And I just want to do a bit of orientation here. So this cartoon obviously depicts the heart. And then on the surface of the heart, we have these blood vessels. And the one labeled number 2, for instance, is the coronary artery. This, in fact, is on the left side of the heart. It goes from, it's at the front of the heart, and it goes from top to bottom. So this would be called the left anterior descending artery. This is the main artery that feeds the muscle, the big muscle of the heart. If we look inside this artery in someone who's had a very bad outcome, this is what's going on. So this artery, this really dark pink circle, is meant to be completely open. All the stuff in the middle doesn't belong there. This dark red part here is actually a blood clot that's formed and blocked off the flow of this artery. The other important thing is this kind of pink crescent moon that goes from about 6 o'clock up to 10 o'clock. This dark crescent moon is actually a large cholesterol core. You call this atherosclerosis or arterial sclerosis, or hardening of the arteries, or lipid layers that are deposited in the artery. So this is a bad thing. This takes many, many years or decades to form. And this is the underlying kind of pathology that leads to bad things like heart attacks to occur. So what can we do about this crescent moon it would be an interesting question. So if I show you this crescent moon in a different way, and in this case, what we're showing with this kind of snowy black and white diagram is this is called an intravascular ultrasound. So this is an ultrasound that's actually taken from inside of the artery. And this little circle in the middle is actually the ultrasound wire that's pushed down the artery at the time of an angiogram. And as this wire sends out sound signals, it's picked up by a receiver on the surface of the chest, and you can reconstruct this picture. All right, so this dark circle in the middle here represents the opening of the artery. And once again, you see this very large crescent here. This represents the cholesterol plaque or atheroma. So this person is potentially headed for a bad outcome over the coming days, weeks, months, or years. So the interesting thing, it's taken decades to get there. So the interesting thing about cholesterol is that this is not just a one-way process of cholesterol coming out of our bloodstream and building up this crescent moon. If you actually work on the cholesterol through diet, medications if you need them, and doing all the other healthy things, what you can see over the course of, in this case, 18 months of sort of intensive therapy, same person, same blood vessel. Again, for orientation, there is the blood vessel on the outside. The opening of this artery, the area where blood now flows, has opened up substantially, and very importantly, the cholesterol plaque that was in that moon has shrunken by about 50%. So this can happen fairly rapidly, in contrast to how many years and years and years that it's taken to build this up. So what goes on with cholesterol in our hearts is actually under our control to change. And this notion of regression or reversal of heart disease is actually quite attractive for all of us. And, you know, even in medical care, we're learning about these things so that the temptation to do some kind of procedure on a narrowing like this is really getting tempered now by folks saying, look, if you actually just work very carefully on diet and don't smoke and get blood pressure under control and really bring those cholesterol levels down by at least half, we can actually open up these arteries. Very, very exciting. So one of the takeaways for you, perhaps, if you know you've got some blockages, then that's the reason for taking those cholesterol medications, trying to improve the status of those arteries. If you don't have a heart problem, then this is the reason that you and your physician or your nurse or other healthcare practitioner may be actually checking cholesterol periodically. Now, if you've had a cholesterol test, what we implore you to do is actually get your numbers and know what they are, because they're your numbers, they're nobody else's. And then look carefully at the LDL, the low density lipoprotein. The L, we think, also stands for the lousy stuff. This is the stuff that gets in the artery into that crescent moon. So if you have a number of risk factors, or if you've had a heart attack or surgery or a stroke, we'll consider you in the higher risk category, and we'll want you therefore to target getting your LDL cholesterol down below 2.0 or so. So really bring that down. This is quite a bit lower than for the average Canadian. If you don't really have a bunch of risk factors, then we'll accept a somewhat higher cholesterol value as your kind of average. But for everybody, I think it behooves us to think about steps that we can take to keep ourselves healthy and well, whether it's with medications or without. So we can move forward and think about some other things. You know, we were talking about food vis-a-vis lipid control, but food is actually very powerful in the context of other cardiovascular risk and overall health. And I like to bring up this one called the DASH study. If we were together and we could see each other, I'd ask you, have you ever heard of DASH? DASH stands for Dietary Approaches to Stopping Hypertension. You can also think of it like the dash of salt, because this is a way of combating high blood pressure simply by thinking about the food that we eat and maybe avoiding the dash of salt. And this study interestingly compared people living in North America, eating a typical North American diet called control, that might have consisted of hamburgers and French fries on a periodic basis, not getting enough fruits and veggies and getting enough fiber in one diet, but getting a lot of animal proteins and unhealthy fats and snacks and sweets. So the interesting kind of comparison is, if instead of that, you introduce more fruits and veggies and grains and fiber, reduce the amount of fats and oils and salad dressings, have less of the kind of the red meat, have more fish, if anything, you'll ask yourself, well, could this make a difference if I just switched up my dietary pattern? And the interesting thing is that it can make a big difference in a fairly short period of time. Like within 8 weeks, people that followed the combination diet, in contrast to people who continue with the North American diet, this expresses blood pressure here, the upper number and the lower number. People who followed the combination diet actually saw a reduction in blood pressure by about 11 points on the top, over 6 points on the bottom. And this is as good as any medication that I can offer you. So the conversations that I have with folks that I see, if their blood pressure is kind of on the border, it's a little bit high, we can say, well, I can give you this pill as a prescription, or if you'll consider trying this dietary program for the next couple of months, then we might get to the same points in blood pressure. In addition, you're going to get all kinds of other benefits from following a DASH-like plan. And another version of this, where you eat more fruits and vegetables and fiber and get healthy fats and eat more fish, well, in large populations, they follow this kind of pattern, especially around the Mediterranean Sea. So this has been called a Mediterranean pattern of eating. And in this study that was actually done in Spain, they compared once again a controlled diet. We can think like North American diet versus having more of this kind of Mediterranean style of dietary pattern. And what they showed that not only might you reduce blood pressure, but you can reduce the chance of having heart attacks, strokes, or dying from heart disease by about 30% if you can sustain this pattern. So there's a lot of power in the food that we eat. And I think that makes it very exciting in terms of what we might be able to do over the long term. Now, those of you who know Mediterranean patterns of eating will also recognize, well, you might have some wine with your dinner, and that can be viewed as a healthy thing. And those of you who know about the French paradox would say, yeah, in French culture, that having a glass of wine is a pretty typical thing. And it's led people to wonder, if you include wine as part of a kind of a social way of approaching food patterns, then that might be a way of reducing heart disease. And that is true on a worldwide basis. And this kind of interesting graph takes us around looking at the risk of dying overall in relation to the number of drinks that one might have per day. And this is called a J-shaped curve or a U-shaped curve, indicating that for people who don't drink anything, that there's a little bit lower risk of dying if you have about 1 drink as a woman or maybe 2 drinks per day as a man. But then you see that there is this sharp and steep line that goes out from there. So drinking too much is not a good thing. In fact, that increases your risk of dying and developing certain kinds of cancer. But drinking a little bit might be okay. Now, for those of us who might be living with a heart condition and diabetes, alcohol becomes a very tricky thing in how it works, brings sugar into our body and messes with our medications and things like this. So the bottom line here is 1 to 2 drinks might be okay, but for many people, less might be better. And if I see somebody who is a non-drinker, I will never recommend that they start. If I meet somebody who drinks a lot, I'll ask them to moderate and bring it back down to this level. Maybe you'll have a question about alcohol later on. Number 5 on our top 10 list speaks to diabetes. And this infographic from Diabetes Canada, the National Diabetes Organization, kind of speaks to how common diabetes is. And about 1 out of 3 Canadians are currently living with diabetes or a condition called pre-diabetes. That is an elevated sugar first thing in the morning, or after a heavy meal, the sugar goes up somewhat and it's just doesn't quite come back to normal. So very common condition, and it leads to all kinds of problems related to health conditions in the body, affecting the brain, the eyes, the heart, the nerves, all kinds of things. And it has a major impact on kind of health expenditures overall. And the other scary thing is that this condition keeps growing year by year. And in comparison to many other nations in the world that are kind of well developed, Canadians are kind of pulling above our weight, unfortunately, in the development of diabetes. So we need to think carefully about this. And November is typically diabetes month, where we encourage people to get screened and think about risk factors. If you are living with diabetes, or even if you're living without diabetes, then the kind of goal in mind is that we would implore you to find a way to get to a normal level of glucose. What this graph shows, that the risk of developing heart problems goes up steeply and steadily depending on the level of our average sugar control. So in comparison to people without diabetes or with excellent blood sugar control, every step thereafter leads to more heart conditions. So let's get towards normal. And once again, here's another number for you to know and own if you're living with diabetes. Number 6 on our kind of conditions would be blood pressure and how we might think about this. And interestingly, many of us will know that the definition of high blood pressure is if your numbers, systolic, are above 140, or if your diastolic numbers are above 90. And that's an interesting kind of way of thinking about definitions, because it sets up the notion that if I'm only 139 over 89, by definition, I have normal blood pressure. Well, the newer concept over the recent years has been there is kind of high, there's a little bit close to high, but then there is really good. And it makes a difference whether you're really good or just kind of borderline. And this study kind of takes us through that this followed a few thousand men over a period of about 12 years. And these men had either a perfect blood pressure, 120 over 80, something that would be called normal, like 130 over 85, or high normal, 139 over 89. And you can see, although all of these folks would have been called normal in terms of their blood pressure, the risk of developing a stroke over a decade is markedly different compared to if you have kind of close to borderline blood pressure versus really normal optimal blood pressure. So you'd rather be 120 over 80 than 139 over 89. And more recently, for people who are living with high blood pressure, when this was compared over a 5-year period of time, for treatment of blood pressure, so you could have a goal of systolic blood pressure just under 140, or you could have a goal of systolic blood pressure really quite good at 120. Well, what was found over a period of 5 years is that you can reduce the risk of heart attack, stroke, dying from cardiovascular events by 25% by getting to this optimal blood pressure number. So if you have high blood pressure, know your numbers, think about them, discuss them with your healthcare practitioner, and see if your target is the right one for your condition. Moving quickly along through the other kinds of risk, well, smoking is unfortunately still an issue in this country, and about 18% of men and 13% of women are still smoking. And this is still, for smokers, the single strongest risk factor for cardiovascular conditions. And we need to work on this over and over again to get to a quit. And, the new year is coming, and that's where the optimal time may be for some individuals. And if you know someone who smokes, or if you smoke yourself, then give it one more try and another try and another try, and get some help and resources if you need them. And I'm sure the Reh-Fit Center can help you out with that. Number 8 will be kind of psychological stressors and long-term strain. And I'm just going to show you these pictures kind of quickly, that stress is a normal thing in response to stimuli that might come around with us. And if we think about our furry friends who go through stresses like a scare or thunder or fireworks, they have this ability to bring on stress, but then recover from it very quickly and then let it go. Humans, on the other hand, have this remarkable ability to get stressed out from something, whether it's something that happened at work or at home or a fright or something. Humans have the ability to get yourself into a situation where you get these repeated stresses, or it just might be a single event that we keep thinking about over and over and over again. And having this level of physiological alerting that keeps hitting us over and over again is very bad for the body, as you might imagine. You can actually measure this. If you measure blood hormones like cortisol, you can see that these levels are high. And then if you start looking at things like blood pressure or blood sugar, these things are much higher. And of course, no one is surprised that if you live with repeated stress that turns into long-term strain, your risk of having a heart attack goes up as well. So this is a really kind of concerning thing. And it may spill over into other kind of daily function things like sleep, that there are many conditions that affect our sleep and prevent us from getting that restorative activity at nighttime. Sleep disorders like sleep apnea, which are so common, lead to elevations in blood pressure and increase our risk of stroke and heart attack, and affect our hearts in bad ways, like making them dysfunctional and bringing on irregular heartbeats and making sugars go up. So if it's hard to control your rhythm or your blood pressure or your blood sugar, and you're sleepy during the day, or if you got a big thick neck, these would all be clues to say You might have a sleep problem, and getting that checked out may be the solution for all other things. Finally, number 10 will deal with physical activity. And I'm going to be a big fan of the upcoming speakers. One will tell you to sit less. The other will tell you to move more and move more in creative ways. And I think that that's fabulous. I'm not going to spend too much time on this because you're going to get some great sessions coming up on these topics. But I will emphasize that there are some important studies that say you can reduce the risk of dying in a big way just by moving. And the first step is the most important step. You don't need to run marathons to enjoy heart health benefits. You just need to get up off the couch and start moving around. And if you sit too much, then you can double your risk of developing a heart attack and dying from it. And if you can just sit less, you can actually lower your sugars by as much as 40% just by standing. You don't even have to run around, just stand. So I would implore you, although many of us might be doing this very dangerous thing right now in our home environments, I'm feeling it very much these days as I do much of my work on Zoom calls and things like this. I would say that this could be one of the most dangerous places that we have at home or at work. And I'm wondering if we should actually put warning signs on these pieces of furniture instead of putting warning signs on exercise videos and things like that. So are you getting enough? Let me ask you that as your number 10 question. Let's try to get at least 30 minutes a day and break it up. So here are some summary ideas for this, that, chronic diseases are important and costly. The things that we can do and learn from societies who can live a long time will tell us that the things that we eat, whether we move or not, the social connections that we have, moderating alcohol, having a purpose in life can really make a big difference. In addition to the risk factors that we typically think about in medical care, couple all of this together, 10 steps to reduce your risk of bad things, and 10 steps to a healthy heart and living longer. Thanks very much for the opportunity to share this. Gord, I'll invite you back and see how we'll proceed with perhaps some questions.
I think Gord had some connection issues, Dr. O, so it's Rhea.
Okay.
But
Rhea,
I will
welcome back.
If you have a question, you can type it in the chat box. And then I think you can see them as well as I can.
Oh, good.
So we can see if there's any kind of dialogue going on. So there's one here. It says, we've heard that people with diabetes maintain a low blood pressure than those without. Why is that?
Great. Thanks, Wanda, for the question. And so the notion is that in the setting of diabetes, some of our organs are at risk because there's this kind of sugar load that's going on all the time. And particularly for organs like the kidneys. Your kidneys, they're in your belly. You've got two of them. They're about the size of your fist or so. They're filtering all of the blood all the time and producing urine that we're familiar with. Well, inside the kidney, there's little tiny blood vessels, and you can imagine they're getting hammered all the time by every heartbeat. If you put a lot of pressure through the kidney that's hammering it all the time, that can really challenge the filtering parts of the kidney itself. So to preserve the function of those little filters in the kidney, having a lower blood pressure, less stress is a good idea. So this is why meticulous control of blood pressure is really important. And indeed, for some people living with diabetes, you may be put onto a medication that's typically used for blood pressure, even if your blood pressure is, quote, normal. So the class of medications like ACE inhibitors, you'll know them because they end in pril, like ramipril, perindopril, lisinopril. Some of you may know those ones. The reason for that is it lowers the pressure in the kidney and preserves the filtering over the long term. The other benefit is if you lower the kind of load in the heart or the eyes, it's similar little blood vessels live there, and you can reduce the stress on the blood vessel system.
Great, thank you.
All right.
Wait a minute or so, see if anybody else has any more questions. So you can see as well as I, but thank you for the talk, Dr. O. How do we create a medical system that empowers physicians to encourage their patients to focus on aspects like this instead of focusing on treatments typical in Western medicine?
Such a great question, and I'm intrigued by your last name, Kevin. So I think that we need to definitely do more to bring these things together, and it's not an either or, but rather together we can achieve so much more. So the medicines are important, the procedures are really important, but obviously all of us are going to be feeling that paying attention to diet and exercise and stress are also critically important. I think we all have a mission around this. And encouragingly, I am seeing our colleagues embracing this more and more, whether it's learning from other cultures and bringing like Eastern Western medicine together, or in fact, like in the cardiovascular realm, conducting more studies that show that actually approaches to conditions that don't involve procedures or surgery are actually as good as jumping to kind of high tech sort of things. So again, for me, it's not one or the other, but to them both. And whoever will champion this, we're going to welcome it together. So thanks for that.
How do you it's just going on me. I don't know if you saw that one about how do you get enough cardiovascular exercise when complicated by arthritis medications that lower heart rate?
Yeah, so great question. Thank you for that. And I feel for you. So you may have been thinking when I was showing those kinds of statistical slides at the beginning that many of us live with a couple different conditions at least, and it becomes the norm. And indeed, when we chat with our clients in the cardiovascular rehab program, about half of our population who've had a heart attack also have some kind of arthritis. Might affect their back, their knees, their hips, their hands. So finding whatever kind of movement works for you is the ideal thing. So sometimes we think you got to walk, you got to get on a treadmill, you got to run. So if that's causing pain, then let's find something else. And if it's getting onto a cycle with your back supported, maybe that's more comfortable, or getting into a warm pool and moving in that way. If our knees are hurting, but my arms are good, then I can use an arm bike and still get my heart rate up and get good effect. Don't focus so much on the absolute heart rate number. The exercise professionals at Reh-Fit and other programs can design a program for you within whatever heart rate you've got. So if you're on those medications called beta blockers, you'll recognize those because they end in OLOL. They're not laugh out loud drugs by any means. They slow down your heartbeat. They kind of bring things down and slow you down. But even with those, if you're getting a smaller rise in blood pressure, but you're still getting something, and you're feeling like you're working and you're sweating and getting a little bit short of breath, well, those are the signs that you're getting a good workout, irrespective of what the heart rate numbers are. So keep going with that. I encourage you, find the activity that works with you. Keep moving in any way that you can.
We'll do one more question because we'll be respectful of your time. So what about people who have atrial fibrillation? Can exercise help with this?
Yes. So great question. So atrial fibrillation, for those of you who don't know, atrium refers to that upper chamber of the heart called the atrium. And normally the atrium beats very regularly as the first kind of signal. Let me bring my hand heart here. And then the upper chamber goes, lower chamber goes, upper chamber, lower chamber. So everything is nice and coordinated in that way. Well, for about 5 or 10% of us on the phone, or on the line today, I'm going to imagine, might have a condition called atrial fibrillation. So instead of the atrium beating regularly, 60 or 70 beats per minute, it starts to quiver and may go irregularly 60 or 70, or in some cases may go 100 or 150 because it gets chaotic. So there's extra electrical signals that are going all over the place. So exercise in the setting of atrial fibrillation is very interesting because there is evidence that says that if you can get yourself trained and at a better level of fitness, then you can actually regulate your heart and reduce the the overall speed of things going on, bring down your sympathetic nervous system so your heart's not prone to quiver and shake so much. And of course, exercise for people with AFib is as good as for people without AFib. So developing things like lower blood pressure, better fitness, stronger muscles, better ability to use sugar if you've got diabetes as well. All of these things are still in play. Sometimes it can be tricky to exercise if you've got fast atrial fibrillation, and you might talk to your doctor about that. Some people go on and have procedures like a burning or freezing in the heart to get rid of that atrial fibrillation. If you've had that, the other interesting news is that if you get into a good structured exercise program, like they offer at the Reh-Fit or either virtual or on site, then your risk of atrial fibrillation coming back can be lowered substantially as well. So exercise, yes, if you have AFib, yes, if you have diabetes, yes, if you have high blood pressure, yes, if you've had a heart attack, do it with all of those conditions. Having a professional in your corner might be a good idea. And I'm glad that you're part of a program or close to a program where you can do a lot of this stuff together.
Great. So thank you, Dr. O, for joining us tonight and giving us such great presentation. And hopefully everybody leaves with a little bit more information. We'll say goodnight to you, and we'll invite everybody that's on right now to participate in our talks next week. We've got some exciting stuff, and they'll be coming to you. So thanks for having us.
You're welcome.
Bye-bye.
Have a good night, everyone.
You too.